So I have with me Dr. Steele today. And Dr. Steele, thank you so much for being with us today and taking your time to answer Medical Club's questions.
Absolutely. I'm delighted. Thank you for inviting me.
Yep, thank you. So starting, a lot of us actually in our medical club are interested into gynecology and obstetrics. So can we know why you chose the field you're specializing in?
Well, Shruti, I've told you this story a little bit before, but
Oh, I think you got muted.
started medical school thinking I would do internal medicine, maybe emergency medicine, maybe neonatology, and it turned out that I really, when I got to my third-year rotations, which is at that time where you started actually working with patients, it turned out I did not like any of those very well at all. And meanwhile, I got to OBGYN, and the very first day I thought, this is it. This is what I want to do. It was just incredibly clear to me. And I think I told you the story that I grew up with a mother who was a labor and delivery nurse who was very excited about me going to medical school and becoming an OBGYN, and being the somewhat contrary person that I was and maybe still am, said, absolutely not, anything but OBGYN. I'm not going to do OBGYN. But then I just fell in love with it. So what do you do?
Absolutely. And I think it's important that we, admit what we like and pick what we like. So I think going along with picking what you like, what personal characteristics do you think are required to be in this field?
Do you mean like OBGYN in specific?
Yes.
I think compassion and empathy, and then problem-solving skills. You have to enjoy solving a problem, because not every person you meet is going to have a straightforward problem, and so you have to be willing to really look with them at what their issues are, and listen, I think, to what it is that's most important to them. About whatever is going on, whether you're talking about childbirth, or whether you're talking about cancer treatment, or anything like that. You have to find out from the patient what's most important to her, because it might not be what we think of as perhaps the most obvious thing.
Exactly. And I think going along with listening to your patient, what do you like the most about your field? What do you like the most about gynecology, and why do you like it?
Well, so really, as a subspecialist in high-risk pregnancy, I don't actually do gynecology, so I have to be perfectly clear about that. I did a residency in obstetrics and gynecology, but then I did my fellowship in maternal fetal medicine, which is all obstetrics and high-risk obstetrics. And what I love about it is just the varied problems that you see. I love the field of genetics, which has been rapidly expanding and is just fascinating. So over the course of my career, we've gone from being able to detect Down syndrome to being able to detect thousands of different genetic syndromes and issues. And I love just working with patients. I mean, I really like my patients for the most part. Every once in a while, I don't, but most of the time I really do. And I want them to, I guess, even if I'm telling them something really difficult and or sad about their pregnancy, I want them to come away feeling like someone listened to them and someone cared about them. And so that's really important to me.
So would you say that the toughest part of your job is probably breaking the bad news?
Yeah, I think that definitely is one of the hardest things about my job. You bet. And because those really difficult and sad cases they come to me. So yeah, I agree. I think that's very appropriate.
Yeah. And so going along the same lines of getting into maternal fetal medicine, what kind of education or training, or what was your journey? Because I know you have a very interesting journey, so I'm sure yeah.
Right. So I went to college thinking that I wanted to be a veterinarian, but then I became quite fascinated with um, uh, Buddhism and Hinduism and became a religious studies major. And then I realized that really there wasn't much that I could do with a religious studies major other than teach religious studies, which I didn't want to do. So I dropped out of college after about two and a half years. And I worked for a while, including as actually for most of those years as a 911 dispatcher. And as part of that, I rode along with ambulances and police and et cetera. And I thought, okay, emergency medicine looks really interesting to me. And I thought about becoming a paramedic, but it pays so poorly, or at least it did at that time. Maybe it's somewhat better now, that I realized, okay, that's not going to fly. So I went back to school. I was working full-time and going to school part-time, and decided to finish my degree in the sciences. And I didn't think I was smart enough to go to medical school. I just didn't have that good I don't know, good an image of myself. And then I hit the point where I had to pick which organic chemistry class to take. And there was one that was kind of on a track for nurses and people who didn't want to go to medical school, and then one that was what you had to take if you wanted to go to medical school. And the rumor at my college was that, or my university was, that if you could get an A from this organic chemistry professor, you could get into medical school. And I think my first semester I got a C, and my second semester, and I was just determined I was going to do it, and I worked my butt off, and the second semester I got an A. And then I decided I'm applying for medical school. And I had a horrible, hideous advisor. This is just a word of caution. Don't always listen to your advisors at college. I had a hideous advisor who kind of looked at me condescendingly and said, "Oh, we both know you're not going to get in." Because at that time I was a single mom. I was working full time, only going to college part time to finish up my degree. And she said, "Oh, we both know you aren't going to get in. Maybe you should try something else instead." And so that just made me more determined. And so and by that time I was doing very well in school, so my grades were good. And anyhow, I applied and got in. So anyway, that's how I got that's how I started out.
Yeah, and I'll be very honest with you. I think your journey is probably the one that has been the most heart-touching to me, and I think one of the most inspirational ones for sure. So I'm glad that you were able to share your story with the students in our medical club. And I think just talking about the same thing, a lot of us students right now in high school are not sure if we really want to take medical school or not. So what do you
Sure.
think we should consider if we want to go into a medical pathway, other than the stereotypical like liking people kind of a thing? Like, what else would you think we
Right.
should be cautious
No,
about?
that's a good question. I mean, I think certainly when you're in college, don't focus entirely on science class. If you want to, I mean, I really think that college is a time to explore lots of different things, and had to hopefully get a pretty well-rounded education. And you don't have to be a science nerd to get into medical school. There were people in my medical school class who were French majors, or who had, worked for, there was a woman who had run a machine shop for years in her hometown, and she finally decided to go to medical school, because her hometown one family doctor quit practicing, and she said, I think I'd like to go to medical school. And her whole community got together to help her pay for it, and with the understanding that she would come back there and practice medicine in her town. So people came at it with just a wide variety of experiences. So I think it's good to have some science under your belt to make sure you like it, but definitely don't feel like that's the only thing that you can focus on. Yeah.
Absolutely. Thank you so much for spending your time with us today to talk
Sure.
to students about your journey. And